Hello, I'm Angela with Healthcare. I am here. Here's my badge.
Hello.
And I'm here to complete your health risk assessment with your insurance company, Humana. The first thing I'm going to do is get your weight and your height. So if you can step on that scale, and when it turns, okay, step off, and when it turns to 0, step back on. Have you been to the emergency department this year, in the last year?
No.
Okay. And, okay, so that's pounds. No, step off. Let me see. We might have to go to a flat surface because, okay, step back on. Because if it's not a flat surface, you can get a inaccurate reading. Yeah, let's go to a flat surface. So we'll step over here in the kitchen. There you go. There you go. All right. 128.4. 128.4. And then 128.4. I'm gonna get your height. How tall do you think you are?
5'8" 3/4.
5'8" 3/4. Okay, turn for me. And just put your heel on this blue tip. Put your heel on it. There you go. And how tall you say you think you are? 5'8"?
5'8" 3/4.
Okay. All right. And that's correct. 5'8" 3/4. All right. You can have a seat. Eight and 3/4. All right. In the last 12 months, have you had any coughing, wheezing, shortness of breath?
No.
In the last 3 months, have you had an unexpected weight loss or a decrease in appetite?
No.
In the last 6 months, have you accidentally leaked urine?
No.
Have you, in the last 6 months, have you had any difficulties with erections?
No.
Okay. All right. Do you have a living will or a power of attorney?
No.
Okay. All right. Do you ever feel lonely or isolated?
No.
You ever have to choose between, I'm gonna get your blood pressure on your wrist. You ever have to choose between buying medication or food? Like not have enough money, either you can only have to buy medication or only have enough to buy medication or food. Nope, keep that there.
Sometimes I don't have money for food.
Mm-hmm. I'm saying, do you have to choose though between buying medication or food?
No.
Okay. All right. Have you ever been diagnosed with depression or anxiety?
No.
Okay. Do you have COPD or asthma?
No.
Okay. Do you have arthritis?
No.
Okay. Have you had a diagnosis of osteoporosis?
No.
All right. Do you have any safety issues that need to be addressed around the home?
No.
What does that say?
122, 71.
71. What's the heart rate?
90.
90. Okay. Stand up for me. I'm going to check to see if you have orthostatic hypotension. That's when your blood pressure drops when you stand up. Okay. Let's see here. Are you in pain?
No.
Do you get numbness in your feet?
No.
All right. Do you get pain in your legs when your legs are elevated or when you're lying in bed?
No.
Okay. Did I ask you if you get numbness in your feet?
Yes.
And you don't? Or okay.
No.
All right. Do you get excessive bloating after eating?
No.
Okay. Open your mouth for me. Cheese. Hard so I can see your gums. Good. I'm going to look in your ears. Okay. All right. Do you get excessive bloating after eating?
No.
Okay. Oh, you got someone's upset up there. Okay. Thanks for reading the error, so let's do it again. Have you ever had a heart attack?
No.
A stroke?
No.
A seizure?
No.
Cancer? Are you a diabetic?
No.
Okay, good. All right. Do you have HIV?
No.
All right. Do you have any stents in your heart? Pacemaker? Defibrillator?
No.
Been diagnosed with atrial fibrillation?
No.
AFib?
No.
Good. Okay. You have chronic kidney disease?
No.
Any allergies to medication?
No.
Okay. I'm going to listen to your heart and lungs. Deep breath in and out. Again. 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 One last time. Breathe normal. Rapid heart rate. Okay. Do you wear glasses?
No.
Have you seen an eye doctor in the last 12 months?
No.
No? Okay. All right. Are you right or left-handed?
Left-handed.
Okay. Have you ever used tobacco?
A long time ago.
How much you used to smoke a day?
Every blue moon.
Less than a half pack?
Yes.
Approximately how old were you when you first started? If you had to guess.
Maybe 10.
10. And how old were you when you stopped?
18.
Okay. You drink alcohol?
Every blue moon.
Okay. All right. So once a month or less? Or
once a month, really.
Okay. Ever been to an alcohol or drug treatment program?
No.
Okay. Let's see. Much better. Okay, you can have a seat. Your heart rate increased when you stood up. Okay. Did you feel dizzy at all when I took your when you were standing and I took your blood pressure?
No.
Yeah. Okay. All right. You wear hearing aids?
No.
Okay. I'm gonna do a quick hearing test, okay? Cover your ear. Close your ear. Put your finger over your ear, and let me know if you can hear this. Okay. Do your other side. Good. Okay. All right. Can you sit back on the couch so your feet is kind of dangling? Your legs is kind of dangling. There you go. Just gonna check your reflexes. Not real good, but okay, pull your pants leg up for me. So this is your patella, and so right under your patella, I should get it. I'm not hurting you, am I?
No.
Okay, there we go. This one. So, there we go. That was a good one. Good. All right, you can put your pants legs down. Okay. Oh wait, I gotta do your knee. Your foot. So I'm just gonna point your toes up, hold your foot up, then hit the back. Check your ankle reflexes. Good. Hold your foot up. Good. All right. Good reflexes. Now for this test, I want you to close your eyes and I want you to tell me where you feel, right or left, what toe you feel, any feeling if you feel anything, okay? Mm-hmm. So kick your feet up. Close your eyes. Where'd you feel that?
Right here.
Just tell me left or right.
Right foot.
Right foot, okay. Where'd you feel that?
Right foot.
Where?
My big toe.
Okay. And talk a little louder so I can hear you, okay?
Okay.
What was that?
It's my right foot. Pinky toe.
Okay.
Left foot.
Okay. Where'd you feel it?
Across my foot. Upper foot.
Okay.
It's my third toe, my middle toe on my left.
Okay. What was that?
That's my second big next to the big toe on the left foot.
Okay. And there.
Pinky on the left foot.
Oh, you keep jumping away.
Pinky on the left foot. Bottom of my foot.
All right, thank you. Good. All right.
I can open my eyes.
Oh yeah, I'm sorry. You can open your eyes. All right. Let's see here. All right, let's get the chart and clean this off. So they don't have any tests for you today. You know what medications you're taking, or you need to get a list, or your pill bottles.
I know my medications I'm taking.
Okay. All right. You're finally getting some fall weather, huh?
Yeah, it's my favorite weather.
Yeah. I see your birthday's in October. You a Halloween guy?
It's my favorite holiday.
Okay. So we're all set with the testing. So now I'm gonna get the computer and just ask them. Most of the questions I already asked you. So okay, one last thing. If you can lean back, like lay back and put your foot up on the couch. I just want to examine your stomach, your abdomen. Okay, just maybe lay this way, yeah. And you can put here you go. Get the pillow.
Okay.
There you go. Will you pull your shirt up for me? Okay. I'm just gonna tickle it out. Okay. All right. Any pain or discomfort with that?
No.
All right. Good. Okay, you can sit up. All right. What's one thing that I did want to do? One thing before we get started. Okay, it's not in here. Okay. Don't worry about it. So I'm going to start our face-to-face. I'm going to ask you some general questions. Okay, start. All right. I'm meeting you at your home. Okay. And you're African American, Black, American. You prefer English?
Yes.
You married, single, widow, divorce?
Single.
All right. Employed, unemployed, retired, disabled. Unemployed, seeking work.
Seeking work.
Okay. All right. And do you have a primary care provider?
United Healthcare.
Your doctor?
I forget the name.
Okay. Do you receive care from the VA?
Dr. DeWood.
Okay. Do you receive care from the VA?
I don't think so.
Okay. The Veterans Administration. Okay. Have you seen your primary care provider in the last 12 months?
Yes.
Okay. Do you have an upcoming appointment that you know of?
No.
Okay. All right. And you said your provider's name is?
Dr. DeWood.
DeWood? Okay. Dr. DeWood. All right. Thank you. All right. All right. Do you take medication? Oh yeah, you said you knew what you were taking.
Yeah, I take medication.
Okay. Do you use oxygen? Supplemental oxygen? Okay.
No.
All right. And what medication do you take?
Dextroamphetamine, 20 milligrams.
Okay. Mm, 20 milligrams. Okay. Once a day?
1.5.
1.5 a day?
Yeah.
Okay. And is that for ADHD?
Yes.
Okay. 1.5. Okay. Take anything else?
No.
That's it? Okay. You take any over-the-counter supplements, vitamins?
No.
Okay. You have any allergies to medication?
No.
I was seeing if you had any labs. No chronic kidney disease. Okay, I want you to think about your parents, your siblings, and you have any children?
No.
Okay, I want you to think about your parents and your siblings, okay? And just answer yes or no. Does anyone, to these questions I'm going to ask you, does anyone have or had cancer?
No.
Diabetes?
No.
I think your dad, right?
I don't know.
No?
I don't
Okay.
think so.
Heart disease?
No.
High blood pressure?
No, not that I know of.
Mental health disorder?
No, not that I know of.
A stroke?
Yes.
Okay.
Mother.
I said just yes or no.
Oh,
You don't have to go into who had it and all that. Just
okay. Sorry.
yes or no. Oh, you're fine. I just didn't want you to have to do more than you have to. Just keep it simple. All right. All right. And you said you don't feel lonely or isolated.
No.
You have a steady place to stay.
No.
Okay. Let's see. All right. Okay. So these are the options. I have a steady place to live. I do not have a steady place to live. I have a place to live today, but I am worried about losing it in the future.
3.
I have a steady place today, but I am worried about losing it in the future.
I don't know if definition is steady. I'm steady right now.
Okay. All right. You don't feel lonely or isolated. You don't have to choose between medication or food. You don't have any safety issues around the home that need to be addressed. You can bathe and groom yourself.
Yes.
Okay. You pay your bills, buy your groceries.
Yes.
Okay. So mostly these are all the questions I've asked you. I'm just reiterating, make sure I get the right information. Okay.
Oh.
All right. And you don't have a living will or power of attorney. You're not in pain. You haven't seen an eye doctor in the last 12 months. You don't wear glasses. You don't have any issues with your teeth. No coughing, wheezing, shortness of breath in the last 12 months. Have you been diagnosed with pulmonary fibrosis?
No.
Okay. You smoke tobacco. You don't now. Less than a pack. Started at 10 and stopped at 18.
No.
Was that right?
Yeah. You just say just smoke it. It wasn't regularly.
I
I
know
don't know
that
if
it
that
just,
matters.
no, it doesn't matter. Just how old you were when you started dibbling dabbling, and how old were you when you completely stopped. Is
Yeah.
that correct? 10 and 18?
Maybe 19, 20. I smoked one cigarette, one in at a party or something.
Okay.
So I'll say 20 just in case.
Okay. You don't wear glasses. Okay. Never had a heart attack. No shortness of breath. No stents. No pacemakers. No pain in your legs when they're elevated or you're sleeping. No defibrillator. No atrial fibrillation. Do you ever get chest pains?
Um, yeah, but not for any reason. Just sadness sometimes. But
Like you feel pain in your chest? Discomfort in your chest?
yeah, but it's not. It's like a heart, like a sad, like a longing more than an actual health disease. It's like psychological.
Okay, so do you get pain or discomfort when you walk uphill or hurry? No. When you get the pain or discomfort in your chest, do you have to slow down or stop what you're doing?
I'm usually not doing anything. It's
Okay.
not. If I was doing something, it might not even be like something. It might not even be a thing.
Okay. Does the pain or discomfort go away if you stand still?
Mm, no,
Okay. Does it usually go away within 10 minutes?
no,
Does the pain or discomfort ever radiate to your left arm, upper left arm, left anterior chest, or sternum?
no.
Okay. And you don't get excessive bloating after eating. No difficulties with erections, haven't leaked urine, don't have arthritis, never had a stroke, never had a seizure, don't get numbness in the feet, drink occasionally, monthly or less. So these are the options for drinking: monthly or less, 2 to 4 times a month, 2 to 3 times a week, 4 or more times a week.
A month? Wait,
Monthly or less,
monthly
or
or
two to
less?
four times. Monthly or less. Okay. All right. And how many drinks would you have when you do have a drink?
Um, maybe
1 to 2, 3 to 4, 5 to 6, 7 to 9,
whatever
or
the
10 or more.
whatever the max is. It depends.
10 or more.
No, I would just say
7 to 9, 5 to 6, three to
just
four.
say
Excuse me.
when I do drink, it's maybe 7 to 9.
Okay. How often do you have 6 or more drinks? Oh my goodness, excuse me. On one occasion. Less than monthly, monthly, weekly, daily, or almost daily.
Out of a year, less than monthly.
Okay. Okay. Have you ever, what is going on? Right. I don't know why I keep coughing. But I'll put my mask on. But I'm sure it's just my allergies. Sorry about that.
Okay.
Okay. Have you used the substance in ways that are dangerous to yourself or others? For example, overdose or driven under the influence or blacked out?
I never blacked out or any of that, but one time, a long time ago, and I maybe I don't even know when I have a drink under the influence
You
irresponsibly.
have you ever
Hmm?
have you ever
Ever what?
anything that I just mentioned? Use the substance in ways that are dangerous to yourself or others. For example, overdose, driven while under the influence, or blacked out. Yes or no?
Yes.
Okay. Social or interpersonal problems related to use. Has substance use caused relationship problems or conflicts with others?
Yes.
Have you failed to meet your responsibilities at school, work, or home because of substance use?
You say it again.
Have you failed to meet your responsibilities at work, school, or home because of substance abuse?
Yes.
When you stop using substance, do you experience withdrawal symptoms?
I, I don't notice it.
Okay. Have you built up a tolerance to the substance so that you have to use more to get the same effect?
Yes.
Have you started to use larger amounts or use the substance for longer amounts of time
Are you saying this currently or have I before?
currently?
No.
Okay. So,
And same with the other ones if it was currently.
yeah, so if the only ones that's not currently is like, have you used or have you ever? Okay.
Yeah, so if
So,
any of those past ones was currently, then this is no.
okay. Have you tried to cut back or quit entirely but haven't been successful?
Um, I have.
Well, you're not using now,
No.
so that would be a no. Do you spend a lot of your time using substance? You're not drinking now, so I mean, I'll let you answer the question. Do you spend a lot of time using the substance? Yes or no?
No.
Has your substance use led to physical health problems such as damage to the liver, lungs, lung cancer, or psychological issues such as depression or anxiety?
Um, Maybe psychological issues
Okay,
for maybe a day or something. I don't know.
okay. Have you skipped activities or stopped doing activities you once enjoyed in order to use the substance?
No.
Have you experienced craving for the substance?
Yes, I have before.
Okay, all right. Are you actively participating in an alcohol treatment program?
No.
Okay. And you're not using a medication. Oh, you are. So, are you using a medication or substance with a dependence potential? And you have Adderall, so that can have a potential dependence. Do you have a past diagnosis of substance dependence, or have you participated in a drug treatment program in the past?
Um, no.
Okay. All right. And you say you've never been diagnosed with depression or anxiety?
Maybe anxiety, which was which which diagnosed me with Adderall.
Okay.
The anxiety came from ADHD.
Okay. All right. So this is called a PHQ-4 test. So over the last 2 weeks, how often have you been bothered by any of the following problems? 0 is not at all. 1 is several days. 2 is more than half the days. 3 is nearly every day. So I will explain that a little better. Where 0 is not me, not at all. 1 is mild. 3, like mild, it it bothers me a little bit. 3 is severe, it consumes my day, and 2 is in the middle. Okay? Feeling nervous, anxious, or on edge.
1,
Not being able to control or stop worrying.
2,
Little interest or pleasure in doing things.
1,
Feeling down, depressed, or hopeless.
1,
All right. Have you wished you were dead or wish you could go to sleep and not wake up?
no,
Have you actually had any thoughts of killing yourself?
no,
Have you ever done anything, started to do anything, or prepared to do anything to end your life?
no,
Okay. All right. And you're not a diabetic.
no,
Have you been diagnosed with hyperglycemia?
no,
And you haven't been diagnosed with osteoporosis. You don't have HIV. You're not taking a medication that will cause suppression. Okay. No uh, no radiation. Have you ever had skin cancer?
no.
All right. And you said no to any other cancer. All right. So your temperature was good, 98.6. Okay.
Yep.
5, 8, 28.4. Yes. Based on your height and weight, your body mass index is 19.5. That's good. And you have no decrease in appetite, no unexpected weight loss in the last 3 months. And you go out and about, right?
Yes.
Have you dealt with any psychological or acute disease in the last psychological stress or acute disease in the last 3 months?
No,
All right. Any neuropsychological problems?
no,
Okay. So we have two heart associations. One heart association says the blood pressure should be less than 120 over 60. The second heart association says once you get older, your blood pressure should be less than 140 over 80. Okay?
mm-hmm.
So when you were sitting, your blood pressure was 122 over 71. And when you were standing, your blood pressure was 133 over 70. So normal heart rate is 60 to 100. when you were sitting, yours was 90, and when you stood up, it increased to 112. Okay?
Mm-hmm.
And I want to check that again because that was uh, pretty high. Put that on your finger. See if you relaxed a little bit. Did you feel dizzy at all when you were standing? I took your blood pressure.
No.
Okay. Normal oxygen level is 90 to 100. Yours was 99. That's good. Okay.
Mm-hmm.
All right. And let me see what that is. Nice. Okay, stand up. Oh, I'm sorry. I was reading the wrong thing. Let's see. Do you have any open sores?
No.
Okay. And you don't have dermatitis. Your lower
No.
extremities doesn't show that you have look like you have venous stasis or venous insufficiency. And your lower extremities were not cool to touch. You have no amputation, no clubbing of the fingers. Okay. Stand up for me. 94. Okay. No autoimmune diseases.
No.
All right. Your lungs were clear. Your teeth look good. No periodontal disease. No cleft lip. Do you have cataracts?
No.
Okay. Let me see what that is. Uh, stand up for me. Let me see it. Hold on. There we go. It's going down. Okay. Oh, it went to 99. I'll take that. 99. So if if your vitals are out of whack or whatnot, then I would have to call your doctor and make them aware, notify them of your pulse or if your heart rate was out of range or
Mm-hmm.
whatnot, and get further instructions on what they want to do. Okay, so it's good that we got that down to 100. So I'll change that to 100, and I'll change it in here because it will prompt a urgent referral or issue. Okay. All right. Excuse me. Okay. And your heart sounded good. And let me see your pedal pauses. Pauses. Good. Let me see that one. Good. Normal. No edema. Your abdomen's good. Okay. Here you go. I want you to draw me a clock big enough where you can put all the numbers in there and use the short and long hand appropriately and make it the hands point at 12:05, 5 minutes after 12, okay? Additionally, I'm going to tell you 3 words. And in 3 minutes, I'm going to ask you to repeat the 3 words that I tell you, okay? And the words are going to be pencil, light, hamburger. Can you repeat the words to me?
Pencil, light, hamburger.
Okay. Hey Siri, set my timer for 3 minutes.
3 minutes, counting down.
All right. And put all the numbers on the clock. Okay. Your effect is normal. You're left-handed. Your speech is normal. Your facial, you don't have any facial weakness. Facial asymmetry is good, normal. Your monofil test was good. Your big toe position was good. Your vibratory sense was good, right and left. Your ankle and knee reflexes were good. You don't have any hand tremors, movement disorder, muscle atrophy, no paralysis.
Sorry, I'm a little tired.
That's okay. Okay. Hey, hello. Okay, that's good. Had me worried for for a minute.
Mm.
All right. All right. You seem to be a perfectionist.
Try to stop that.
Okay. I have some diagnoses here for you that's already in your chart. The ones I'm unsure about, I'm going to ask you if you've been diagnosed with it or not. Okay? Have you been diagnosed with bipolar disorder?
No.
Insufficient evidence. Diabetes, you said no, right?
No.
No. Insufficient evidence. Hypothyroidism.
No.
Insufficient evidence. Osteoarthritis, you said no, right?
No.
Can you tell me the 3 words?
No.
The 3 words that I told you to remember? Can you tell me those words?
I don't remember one of them. I forgot. I thought it was only to remember while I was doing the clock. So I discarded it from my memory.
Okay, can you like take a minute and think about it?
Cereal. I'm just gonna say no.
Okay, I'm gonna tell you. Yeah. Pencil, light, hamburger. Hey Siri, set my timer for 3 minutes.
3 minutes, counting down.
Okay, osteoarthritis, insufficient evidence. So today, what we identified they consider having those many drinks at one setting as alcohol abuse. Okay.
Yeah.
And then we have ADHD and your blood pressure because it was 122 over 71 and they want it to be less than 120 over 60. So therefore you have a diagnosis of high blood pressure. Okay.
Mhm.
Um, they want to know if you want someone to contact you about your mental issues, your mood.
No.
Okay. All right. So at the end of the visit, the computer always populates some suggestions, and the suggestions that populated for you are think about creating a living will. Make sure your doctor is checking your A1C, cholesterol, and kidney health. Talk to your doctor about screening for lung cancer because you used to smoke.
Okay.
And those are all the suggestions they have for you, okay?
Yes.
If you have to get rid of your medication for any reason, it expires or the doctor discontinues it, they want you to take it to one of these pharmacies at the bottom of the sheet that I have listed, okay? This is more information about safe disposal of medication. They just don't want you to throw it in the trash or flush it down the toilet, okay?
Okay.
Alright, so what did I miss? Oh, your doctor's name. So when I go to the last screen to complete the visit, it always tells me if I forgot to do something. So, evaluation resolution center. So it says something about the medication. I didn't do something, and I don't know. Okay, can you tell me the 3 words?
Pencil light hamburger.
Okay, thank you. Huh?
I do want. What are the options for mental?
Someone will contact you and talk to you about seeing someone about your depression or anxiety. Would you like someone to contact you?
Yes. It's just the talk.
Okay.
It's not linked to anything.
Okay. What's going on? What? Keep saying I messed up on some medication. I don't know what's going on. Okay. No. Yes. Are you conducting this assessment at the member's home? Yes. Signature. Status of it is complete. You're willing to sign the evaluation?
Yes.
Okay. Oh, hold on. And you can sign anywhere in that gray box with this. And so this is included in your insurance plan at no additional cost. You'll get a copy of this report in the mail. Your doctor will get a copy of this report, and of course the health insurance company. This visit does not substitute a visit to the doctor's office, okay?
Okay.
So I'm gonna read this to you real fast, okay? I understand that pursuant to my prior informed consent, a clinician from health performed an evaluation of my current health status and provided me with a personal assessment, recommendations, and screening schedule. I also understand that the clinician performing today's evaluation is not assuming and has not assumed responsibility for my medical care. I should direct questions about my medical care to my own healthcare provider, or I should call 911 in case of emergency. The information obtained today and any applicable lab results, parentheses, some of which may become available after subsequent analysis, may be sent to my primary care physician, PCP, or myself if requested. I have received drug disposal instructions and locations. So that's what you're signing for, okay?
Okay.
All right. So, do you have any questions for me before I leave? That concludes our visit.
No.
Okay. And this is for you to keep, and that's my name at the top. Um, and hopefully, I'll see you next year. Okay.
Okay. Thank you.
You're welcome. Thank you for allowing me in your home to complete your assessment. I really appreciate it. And you continue taking good care of yourself. You're doing a good job.
Thank you.
You're Thank you.
Thank you.
I can just let myself out.
Yes.